Welcome to this short presentation about an overview of normal hysterosalpingography. Hysterosalpingography is a fluoroscopic examination of the uterus, fallopian tubes, most commonly used for infertility, to assess the uterine morphology and tubal patterns. Hysterosalpingography can be performed for diagnostic or therapeutic purposes. For example, when injecting contrast media, it dilate and open an area of blockage, the fallopian tube, and this is a therapeutic role. Recall about anatomy. Here we have the vagina, we have a phonesis, we have endocervical or cervical canal, we have a uterine cavity, we have right and left fallopian tubes, we have right and left ovaries, we have fimbria, through which pass the contrast medium for spillage in the peritoneal cavity. Also, here we have an intramural part of fallopian tube, we have isthmus, we have ampulla, we have infundibulum. Here there is a normal pacification of uterine cavity, normal pacification of right and left fallopian tubes, and you can see bilateral free spillage of contrast medium in the peritoneal cavity. For indications, there is infertility assessment to assess uterine morphology and tubal patterns, recurrent abortions following tubal surgery to establish tubal patterns, post-sterilization to confirm tubal ligation, post-tuboplasty to assess its successfulness. Among the contraindications, we have pregnancy, active pelvic infection, recent uterine or tubal surgeries, during menstruation, active uterine bleeding. For patient preparation, the patient is scheduled for exam between 7th to 10th day from the first day of menstruation. The patient should abstain from unprotected intercourse between booking the appointment and the time of examination. If there is any uncertainty or ambiguity about the patient pregnancy status, a pregnancy test is recommended prior starting the exam. Analgesics before the procedure are advised. Patient has to bring the pad to use after the exam, as there can be minimal bleeding and the contrast medium coming back through the vagina, and the informed consent should be obtained. For the equipments, we need to have the materials for cleaning the patient, gauzes, antiseptics, medical drops, sterile towels for covering the patient, speculum, topical anesthesia, lidocaine, jelly for lubricating the speculum, hysterometer for assessment if the cervix is open, tuberculum forceps for fixating the cervix. This is fixed on the anterior segment or part of the cervix, as it is less innervated and less vascularized, so there will be minimal pain and minimal bleeding. Rich Wilkinson cannula mostly used, and HSG catheter. This was used in past days. can use a sponge forceps for cleaning. You can use surgical forceps. You can use within a dish or U-shaped dish for cleaning the patient when you have put the antiseptic in it, or for taking the contrast medium. You can use a syringe for injecting the contrast medium in each Wilson cannula or HSG catheter. You can use a sterile gloves, and fluoroscope machine is a main tool to use. You can use a lamp. You can use the contrast medium. Here we have the speculum, which is used to have access to the cervix. We have a hysterometer used to assess if the cervix is open. Here we have the tenaculum forceps used for fixation of the cervix. Here we have the Rich Wilkinson cannula. Here it is where we connect a syringe containing the contrast medium, and the tip is inserted in the endocervical canal. We have the fluoroscope machine, which is the main tool for our exam. For the techniques, we have positions. The main position is AP when the patient is in a supine, and other views like oblique views, either right posterior oblique or left posterior oblique may be additional for better visualization of any structure of interest. A preliminary image of the pelvis when the patient is in supine. Patient lies supine on the table with knee flexed, legs abducted. This is the litotomy or gynecological position. Vulva to be cleaned with antiseptics, example for hexidine or saline. Speculum is then pressed using sterile jelly to expose the cervix. Application of topical anesthesia on the cervix can also be done. Here we have the patient in a gynecological or litotomy position. Verify the cervical opening using a hysterometer. Fixate the cervix using tenaculum forceps. Insert Rich Wilkinson's cannula or HSG catheter connected to the syringe and the syringe containing the contrast medium after removing the air bubbles. Then contrast medium is injected slowly into the uterine cavity under intermittent fluoroscopic observation. When performing an hysterosalpingography, there are some important images to take. We have to take a preliminary scout image where you can see if there are no abnormal calcifications, if there are no pathologies of the bones. You can even see some masses with calcifications, or you can see the outlining of some masses. Here it is an example of preliminary scout image. The second image to be taken is when the contrast medium is filled within the uterine cavity, and the third one, it is taken when there is a bilateral opacification of fallopian tubes. In this step, you can take the oblique views, either right posterior oblique or left posterior oblique, for better visualization of the fallopian tubes. But these views are not always taken because they are additional, and the routine view is another AP. Image. It is taken when there is bilateral spillage of contrast medium within the peritoneal cavity. And lastly, the post-procedure image can be taken. After care, be sure that the patient has no serious discomfort or significant bleeding before she leaves. The patient must be advised that she may have vaginal spotting or occasionally vaginal bleeding for 1 to 2 days and pain. The patient is advised to take adequate oral fluid intake to help elimination of spilled contrast medium. Consult immediately for any unusual concerns. So the possible complications are the allergy to the contrast medium, especially when it is forced into the circulation, for example intravasation. The patient can have pain or cramps. She can have breathing. She can have transient nausea, vomiting, headache. She can have vagal or neurocardiogenic. And for delayed complication, the patient can have infection. Thank you for your kind attention. For further readings, you can read about the pathologies seen in hysterosalpingography examination.